It was 1989, and I had just joined the faculty as a stroke neurologist. And Gary Steinberg and Michael Marks had also just started. We set out to become the first comprehensive stroke center in the country. There had been a number of hospitals who had made an attempt but had been turned down. We went through the review, a little bit anxious, and the reviewers presented the findings with no violations, a perfect score, and it was amazing. It was like a dream. It's every nurse who takes care of stroke patients, every therapist, every physician. It's a very comprehensive team that had to be put together to achieve this designation.
We know that 2 million brain cells die every minute. So there's a piece of our practice that is really designated to time.
We receive a lot of patients from other centers that don't have the innovation and capabilities that we have to treat patients. So before the patient even gets here, we're already taking care of them.
When we get the stroke page, everybody jumps up because time is brain.
Can you tell me your name, sir?
We have everybody there, pharmacy, crisis nurse, the stroke neuro team, doctors. We then, as the technologist, do the CT non-contrast head, send that to the radiologist, call them, then the stroke team decides if they want to do contrast imaging, and from there the team decides if they go to ICU or the emergency room.
Everybody who encounters the stroke patient, from the nurse to the case manager to the physical therapist, everybody has to be meeting top quality standards to show that we're providing truly state-of-the-art care for that patient.
I think our stroke time during the CT was about 39 minutes. We were able to cut it down to 19 minutes.
Working at Stanford in general, you're proud, but to know that you're part of a comprehensive stroke center, it makes me extremely proud.
It's a good feeling to be where I am, to be able to have this connection with patients because they've undergone something that's quite scary for them. A big part of my job is providing reassurance.
Everybody has such a really strong work ethic. It's a culture of Stanford overall that I really think that it is embedded in us.
It's hard to kind of put into words what it feels like. We get to have the privilege of working with patients in one of the most vulnerable times of their life, and we get to see them make progress.
It's amazing to reflect back on the incredible progress that's happened in the field, from a disease that really we had no viable treatment for, to a situation now where we have many options to actually reverse the stroke and turn it around so that they can recover fully. It's incredibly fulfilling.
Many of our staff, our family members have neurological disorders, so this is personal. And I'm just absolutely delighted that we can serve patients and their families in this highly integrated, multidisciplinary way.
I think at the core of it is a desire from everyone to collaborate and pursue excellence and to raise the standard over and over again.
Stanford is always ready to take care of these patients. Our improvement is not driven by our next Joint Commission visit at all. I think our improvement is because we want to see our patients do well. But to have an organization like the Joint Commission come in and tell you that you have a great program is quite a distinction. We're never going to stop getting better. We're never going to stop getting faster, and we're never going to stop with our innovation. So bring on the Joint Commission. We're ready anytime.
Time